Now, a groundbreaking study has identified genetic risk factors that contribute to the high incidence of prostate cancer in African men. The researchers found 3 genetic regions associated with increased prostate cancer incidence, which are common in African population but rare in non-African populations. The results pave the way for the development of genetic tools that can predict an individual's risk of prostate cancer, allowing for earlier screening and intervention. Now, how can the findings of this study be translated into practical solutions for prostate cancer prevention and also treatment in Africa, given the limited resources and infrastructure in many African countries? And let's find out. And we have our guest with us this evening, Jesutomi Akomolafe, Communication and Health Advocacy Manager, Trials of Color from Lagos State. Thank you so much for joining us this evening.
Thank you so much, Doshim.
All right, so now as someone who has worked, in the medical field, how remarkable do you think that this new genetic research on prostate cancer risk in African men is for the future of cancer care on the continent?
Thank you very much, Usman. When I saw that study, my team and I were very excited because that's a major milestone in prevention of cancer, treatment of prostate cancer, as well as saving lives of African men. We have a major problem in our medical space in this part of Africa, which is genetic testing. And such a research which is one of the largest genetic testing in Africa, about 8,000 participants, clearly shows that there's enough reasons why men need to get themselves checked as often as they can. And now this genetic testing reviews a lot of things. It checks the DNA to know who is the carrier of prostate cancer. And knowing fully well that in the African system, most of us who are African men do not have medical insurance. So if you wait till you start to get symptoms, still you start to know that, or maybe you are perceiving that you may have prostate cancer before you go to get yourself checked. Cost of daily treatment is about more than $500,000. You don't even have that to worry about. So when there is a genetic testing result like this, and now Africa is beginning to have genetic testing for prostate cancer, it's a welcome development because you just would know your states early and on time. And you have more than about 49 cases, daily cases in Nigeria, and about 31 of them dying 24 hours per day. That's a whole high risk factor. And such a genetic testing is revealing a lot, and we all just need to ensure that we get tested as often as we can. So what it does for us is early prevention and awareness, because we do not have most of the resources to begin to treat these things when it's of a late stage. And when we are being diagnosed in Nigeria or in Africa or in Ghana, I was in Ghana recently, and we still had these conversations around prostate cancer prevention and early awareness. So the best advocate you can give to yourself and the best defense you can give to yourself is just get checked early as possible. One more thing I need to mention is that there's no time for us to start holding back to family secrets of health histories. There are families that you've had prostate cancer challenges over the years. When you are now a teenager, because even young people now have prostate cancer, you don't have to wait 40 years, 50 years before you go for your PSA. You can do that while even young, when you know that your family has history of prostate cancer, because that's how genetics information are gathered, testing are gathered when you go to,
all right, we will speak more on this, Jesutomi. But then, in addition to, this issue, this incident now, the study also highlights that, African men are at higher risk of developing not just prostate cancer, but more aggressive forms of, this type of cancer. Now, in your clinical experience, what are the challenges that you see, especially in diagnosing and treating prostate cancer at earlier stages in Nigeria?
Okay, thank you very much. I am not a medical practitioner, so all the information I will be sharing today is based on our research in our own team. And one of the symptoms that early treatments that should come in place in this regards is one, when you have issues with painful urination as a man, one of the things, it doesn't show that you may have prostate cancer or thereabout, but it's an indication that you need to get yourself checked. And when there's a report like this that shows that there's African men would have a projection of aggressive form of this, that shows that within the slightest information you may have about your body, the body system, any changes around it, either you're having weak ejaculation, or you're having you're having painful urinary tract and all of this. It's an indication that you need to get yourself checked, because right now there's a high tendency that we have aggressive form of this when you have it, and that's a late stage when you detect it, and that's death. So it is just very important that most of the symptoms that we should begin to look out for as African men, right, is our body system, our body change, and also to go for testing when you know that your family has this track record of prostate cancer or this disease. Go for testing. The result from the researchers from the MedCap about this genetic testing which we just came out, it's a clear indication that we all need to be aware that now we are at higher risks. Even the reports from the Global Observatory marked about the cancer in Africa still confirms that African men are at higher risk of prostate cancer. So what that does for us is to continue to ensure that we put more attention on our health first. And even if you have BRCA gene, that's still a part of what still in the testing, when you're doing the genomics and the rest, it finds out that you have a high tendency of having this cancer. About just more or less like 2 years ago, one of my friends whose father died from colorectal cancer and prostate cancer was not even aware. 2 years after, he passed away from cancer as well. So there's a high tendency that once these genetics factors are coming out and the information are coming out, we all need to be up and doing to ensure that our health comes first, and then we save our lives.
So what are the current screening guidelines, in Nigeria? Do you think that genetic testing should be integrated into these protocols?
Yes, thank you very much. So one good thing about genetic testing is that it takes into consideration your DNA. And there is a test that goes in there to find out if you are a carrier of certain form of cancer, or if you are prone to this disease, or if you have a family history of this disease. And in Nigeria as a whole, we need to begin to include, medical research needs to include genetic testing into this form of treatment, because it will help make better informed treatment to a patient who has been diagnosed. And it is easier when you go for your genetic test now, you know what is in vogue or what has been diagnosed of you. It is very easier for medical practitioners to be able to make suggestions of the best form of treatment for that patient. And some of these treatments, you have clinical trials. We've been invited to Switzerland in March. We'll be with DIA talking about clinical trials and how African also can be part of it as well. And that's why we can also get better form of treatment options to individuals. So Nigeria as a whole, we need to ensure that we improve on our facility, medical facility, and begin genetic testing.
Jesutomi, when you talk about facilities and testing options, when it comes to treatment options, how do you think that these new genetic findings could influence personalized treatment plans for African men that have been diagnosed?
Okay, thank you. So one of the successes of genetic testing is to ensure that you know what markers and variations affect that patient's particular race. You know the diversity of your genetics at that time. So a medical practitioner knowing fully well this is what, because it changes, and the technology changes. So this time around, someone had about 14 of those genes in them. Now it has changed. It could be something else. It could be an addition. So researches are coming up all the time. So for instance, if a patient goes for genetic testing and you find out what the result is, it helps medical practitioner easily profound options to that patient. And, you get survived on time, you get treated immediately. And then, you can have your your chance of surviving, your rate of surviving increases as well. It doesn't necessarily mean that there's like chemotherapy, immunotherapy just targeted at you. No, they know what they are treating at, because there's already a result that shows that this is your lineage, this is what is happening to you, this is what you're prone to, this is what you're a carrier of. And then that treatment began there. And the information you supply to them, you must know health information about both parents, your mother, and then you must have again your diet and your daily living generally overall also influences everything that goes on in the genetic testing. So it helps make better informed treatment for patients faster, and also save lives for individuals, instead of just giving them when you do genetic testing, just ensure that you know exactly what is wrong and know your variations, your health challenges, the history, and everything associated to your race as a whole. Because genetic testing also takes consideration into race as well, into environment, into the body, into many other things as included in the DNA.
Okay. Now, this particular study also found that, the certain genetic loci, that were more common in African populations and almost absent in non-African populations. How do these discoveries change our understanding of the biological mechanisms behind prostate cancer?
Okay, all right. I think one major issue why that came to being is about screening. A lot of individuals feel that screening has to be invasive, and then they don't go for screening. They don't go. Not knowing that even now you could have blood testing. Nobody goes into the bomb to pick up semen and then testing. No, there's now blood testing. So a lot of people are really have not included the prostate cancer test into their health activities, right? So you have a lot of things being found out, being like there is current research as well. You have a lot of things being put into consideration which were not already in other studies of medical research that in our counterparts in Europe and the rest, where they have equal representation of all the individuals in their research. In Africa, it's not like that, and this happens to be even the first of its kind. So new things like this are coming out, and then you definitely the only way to go about this is now to ensure that there's a screening. Don't be more concerned about the invasive form of treatment, because there are better form of treatment that could be, just through the blood testing, and then which is the PSA, of course, and then you get your result, and from there you begin treatment as fast as you can.
Okay, so what about when it comes to education and also awareness of prostate cancer in Africa? Because so many people, so many men have no idea, what this type of cancer is all about. And, we know that this particular cancer accounts for 1/4 of all cancer cases in Africa. What do you think needs to be done to address, the overall awareness?
All right, it's awareness, and boots on the ground. You can't just be all advocates. This message goes to all advocates, all healthcare practitioners. You can't just be behind the camera and reaching out to the people in the underserved population. The communities in Mangu, in Plateau States, the communities, even on the Lagos Island, there are individuals that have never heard the word prostate cancer before. And there are myths currently going on to ensure that cancer is for the rich. Both the rich get cancer, both the poor get cancer. With good diet, you still have cancer. Awareness cannot be said enough. We need to take this message to them. The government needs to support advocacy groups, also support healthcare practitioners to take this message of awareness to them, for them to be aware that there's need for them to get checked, and there's need for them to put their health into consideration. And then one more thing again is that currently I see the Johnson & Johnson partner with one of our healthcare industry in Abuja, and about 1,000 or 3,000 of them got screened, and more awareness were also distributed to them in Abuja. That's the northern Nigeria. That also needs to be spread across all the 36 states in Nigeria. So what we should do is to have more boots on the ground, more people with this information to go out there for them, more screening platforms for them. And then maybe we should also be aware that there is need for health insurance. When you ask Nigerians today or Africans today, How many of you have health insurance? In the case of any health challenges, you will find that only few percentage of them do have. So what is important is awareness, get checked and do the right thing. Have health insurance as much. Subscribe to them. There are better healthcare insurance you can purchase, which will be of benefit to you when the days get tough in terms of health. You can never be so certain about your health. And what is very more important is that you get yourself checked. You don't have to feel anything. The young people have prostate cancer. People feel prostate cancer is for the older generation, but no, when you have family history or other things could mitigate, could be a factor of variation into your health, and then that could happen. So what is important is that we begin to be aware of our health, begin to take actions towards our health, and the government needs to continue to support advocacy groups and healthcare practitioners to be able to do the best of their job in saving lives of Nigerians and in Africa as a whole.
Okay. Now, how would you approach counseling African men? Because I know we did talk about, education and awareness, but, most African men are adverse to counseling. How would you counsel them, those who are at high genetic risk for prostate cancer, considering cultural perceptions and also stigma surrounding cancer diagnosis in many African communities? And you actually did touch, a bit on this earlier.
Yeah. So one major thing that African men we all should know is that men don't talk. Mm-hmm. You might be going through a serious pain, you don't talk because you don't want to feel weak. But trust me, there is nothing as sweet as being alive. Open up if you feel something is wrong. Once you know you're at higher risk, now we do know Africa is at higher risk. The death mortality rate is very, very high in Africa. Over 700,000 of those deaths we are recording. So it is very important that you open up and speak up. Yes, the women, when the women feel something, they go for checkup, they speak, they talk to their husbands. And I think the women should not think that their husbands are wicked vessels when they begin to talk about their health challenges. That's where you have this conversation. We also need to have focus group discussion, focus group that exist around this as a whole. I don't think we ever have sustainable focus group in Nigeria where men could just, walk into there, talk about their challenges, be free, and then everyone could contribute based on their past experiences. That also helps with healing process and also making the right choice for the health as well. Men don't talk. So I would advise that men open up and speak. If you feel anything, you don't need to treat yourself over the counter or, treat yourself in the house or endure the pain and think the pain will go away. No, all you need to do is take your health into your hands and speak up. You're not weak. You deserve to be alive. So speak up and get yourself tested as much as you can. Talk to your partner about it. Let your partner know your health challenges.
All right. So what role do you believe that, lifestyle factors like diet, exercise, and what we eat, or even alcohol consumption play in modifying the genetic risk of prostate cancer?
Yeah, that's also a major factor as well. And men, we also need to understand that there is no luxury in smoking. You may find comfort in it, but those things tell in the long run. Drinking of alcohol also has a major role to play in it. Have a good, healthy lifestyle. Yes, a lot of people have reasons for doing all of this, but how long do you want to live? And how do you want to enjoy your old age as you're growing and you're aging as well? So you need to ensure that your diet, proper exercise, you take that into consideration. One, you also have good diet. You can stay away from smoking and drinking and you have a perfect health condition. And if anything happens to you, you can easily tell what is wrong. We have some individuals who still have the perfect diet, the perfect good health condition, and still get diagnosed of cancer. And this could be for various reasons in the genetics mutation and variations, which we just talked about. But with all of that, if that's not the case, your diet and healthy lifestyle need to be put into consideration, because this is how you look out for yourself before what would happen may happen, or what you don't plan for to happen. So dieting, proper exercising, obesity, and the rest, watch out for your weight as well. All of these would help, when you put proper consideration, and to give you much longevity, in existence. So be careful of what you drink, be careful of smoking. You can be a second smoker because you're not the one smoking, so inhaling it makes you both prone to whatever would happen when you talk about lung cancer, in the long run.
All right, now the study, still on this particular question, the study actually involved collecting demographic, social, economic, and clinical data as well, alongside, bio or genetic samples. Now, how important, is it to consider social and economic factors in understanding the full scope of prostate cancer risk?
All right, thank you. I think it was about 8 countries or 5 African countries that were sampled in that research with about 8,000 participants, if I'm correct. And I think that more investment should be done to have more people, because Africans have different variations in their gene, in their genetics. We need to have more of this, first of all, and we need to have more countries being part of this genetic testing as often as we can. Now, this in itself, we really don't know where. Those who sponsored it have a reason, because one, want to be able to tackle this issue of prostate cancer. Two, want to ensure that people have a very good life existence and also treatment options. But again, we need to be able to spread. All government need to come together, not just Ghana, not just Nigeria, not just South Africa, not just Kenya. Everyone needs to come together, especially the healthcare industry, to begin to have more collaborative efforts in research, whereby you have sampling of Nigerians, you have sampling of Cameroon, you have sampling participants, across this region, not just 5, but we have about 59 of African countries or thereabout. We can all have equal of these individuals in this genetic testing. That will begin to record success rates as a whole, because this is just the beginning. We really do not have everyone represented, all the countries represented, although the sampling was a very good sampling as well. But we can begin to have more of this testing where everyone is represented, and it will better have an informed decision in the medical practice and also testing as a whole.
Jesutomi, I know you did talk about, early diagnosis, but, when I read about the research, one thing that struck me was the fact that this type of cancer, that's prostate, is often diagnosed at later stages in African men. Now, do you think that these new genetic insights could encourage earlier interventions, like more frequent screenings for those at higher genetic risk?
All right. The problem is not having screening. That's a problem. But the problem is about the people being able and willing to get screened. With this information being out, I think the best thing that is happening is that, New Central is having this conversation now, because this is the form of awareness to everyone, knowing about this data, knowing about this information, and, sitting up tight to get to do the right thing that they are supposed to do at this time, right? So I think what is very important in that regard is to ensure that, one, people get to be aware of this information, like I mentioned earlier, and everyone are getting up to get screened. And when you begin to do this, government starts to build centers and begin to have interventions that will accommodate everyone. I mentioned that of Johnson & Johnson being partnered with our healthcare industry in Abuja. There was screening there. There were awareness. The information were out there. And this thing needs to spread across all the regions as well. So this may impact the screening rate and may not really impact the numbers of people going for prostate cancer screening. Because by the time they even get screened, most people get screened late, according to what we are aware of. They get screened late, and at that time, it's terminal.
All right. So now, what are the key next steps, that you would recommend for both researchers and also clinicians, especially in utilizing this genetic data to combat prostate cancer in African men? Are there any immediate changes to the clinical trials or clinical practices that you would recommend?
Okay, one thing I want to first of all mention is that I would like pharmaceutical companies to begin to partner with our research industries and research technicians in Nigeria, like Pfizer, like Jesutomi, like a whole lot of them like that, to be part of the research in Nigeria. Clinical trials is something that in Nigeria as a whole is not having so much success rate as much as it is having in Europe, in the US, and in other countries like that. They're not having much success rate, and the popularization is not going out well. And people also need to understand, Nigerians, Africans as well need to understand that clinical trial does not make you a guinea pig. It does not make you a social experiment. In fact, you get treated. There is a whole lot of variety of treatment options for you, being part of clinical trials. And this is where new drugs and, new drugs that are already available in the market, are made available to you with all forms of observation and care after you. And this is how you can even get, survive certain form of cancer. I have friends who currently, they are survivors because they are part of clinical trials. So in Africa and Nigeria, we must begin to encourage ourselves to be part of clinical trial. What is clinical trial? So for instance, now there are qualifications because you also need to qualify for clinical trials. So if one, for instance, has survived prostate cancer before, there might be a new research into prostate cancer, for instance, and then they want to be able to test, how effective this drug can be, when being used as a form of treatment. And then you can be part of it as well. You can help save life because the paracetamol that you take, the painkiller that you take, all went through clinical trials. There were individuals who were part of the clinical trials before, they are being used on you. And you can see the effective. We have malaria killing thousands of Nigerians every year. Those drugs, those anti-malaria medicine also went through clinical trials. So there's a clinical trial going on right now in the cancer industry that we all as Africans need to embrace. It's not just for the whites, it's not just for the Latino, the blacks also need to be part of it. We've been pulling out for so long, but we need to be part of it, make up the numbers. In the United States, where we have some of our advocacy groups and the rest, you have about 5%, a little bit 5%, about the African Americans who are part of clinical trials.
Yeah.
And that's not really, good in terms of medical research as regarding cancer.
Right, Jesutomi. And from what you've just said, I believe you meant that if, more Black people were part of clinical trials for prostate cancer, this research, that just came out would have been, would have actually come out long before now. But then, thank you so much for joining us and also speaking to us on this very, very important discussion. Jesutomi Akomolafe, Communication and Health Advocacy Manager, Trials of Color.